The House will come to order. Conference Committee report.
Conference Committee report. This is the Huntley motion. Conference Committee report on House File 1233, an act relating to state government. The report's addressed to the Honorable Paul Thiessen, Speaker of the House of Representatives, and the Honorable Sandra L. Pappas, President of the Senate. We, the undersigned conferees, for House File 1233, report that we've agreed upon the items in dispute and recommend as follows. The report signed by 4 of the 5 conferees on the part of the House and 5 of the 5 conferees on the part of the Senate. Huntley moves that the report of the Conference Committee on House File 1233 be adopted and that the bill be repassed as amended by conference.
I recognize the author, Representative Huntley, who will explain the report.
Madam Speaker and members, this is the Omnibus Health and Human Services Finance Bill. We finished up in Conference Committee this morning at about 1:30. There are some changes. Most of what we had in the original bill are still in there. There might be some tweaks to them. But the biggest changes that occurred is that when the bill passed the House floor, we had a $150 million cut target, which we reached in that bill. That was reduced during the Conference Committee to a $50 million cut, which made things a lot less painful. But this bill does contain a $50 million cut in the general fund spending for health and human services. And that's $50 million below the base we had last year. So there is still a cut there. When the bill left the House floor, we had a $105 million hospital surcharge, which, as I said on the House floor then, there was a lot, there were winners and losers the way the formula worked out. That is no longer in the bill. We also had things in the bill that would allow us to capture some of what we think are excess reserves in the HMOs. That is no longer in the Conference Committee report. So those are 2 big changes. I was happy to see the hospital surcharge one go away. So I think those things I just talked about are good. There is one bad thing in this bill that I feel is bad, and that we had about a 3% plus COLA, or increase in spending, for long-term care facilities. These are facilities that take care of primarily people with disabilities. And I have always been committed to treating them exactly the same as I treat nursing homes people, and I was unable to do that. We had in our budget when it left the House floor about $60 million for long-term care facilities, and the governor had essentially zero, and the Senate had I forget what it was, $7-8 million. So we lost on that one somewhat, and we went down to, I'll talk about that in a minute, about $26 million. So I'm disappointed with that myself, but there are other things in the bill that I think are pretty good. That's what I would consider the one bad one. How did we raise the money to pay for this? When we got rid of the hospital surcharge and the HMO reserves, we added 2 items. One, currently the HMOs pay a surcharge to the state on their activities, and we're not increasing the surcharge. We're just going to say that the HMOs have to pay that a couple months earlier, one time, and that's worth about $40 million to our budget. Secondly, we did the same thing with hospitals. We have a current surcharge that the hospitals pay us for their medical assistance and Minnesota Care programs. And again, we moved up the date, so they will pay us a little bit earlier. And again, that's about a $40 million addition to our budget in this biennium. Has that packet been distributed? Well, I'll just tell you, there's a packet that's going to be distributed that has letters of support for this bill from the Minnesota Medical Association, the Long-Term Care Imperative, the Association of Minnesota Counties, the Minnesota Hospital Association, the Minnesota Dental Association, the Minnesota County-Based Purchasing Entities, the ARC of Minnesota, the Minnesota Disability Law Center, the Minnesota Budget Project, Take Action Minnesota, and Legal Aid Minnesota. So they are all in favor of the bill. Most of those letters are overwhelmingly positive. There are some that are positive, but mention a few things they don't like about the bill. Is it out? No. Okay. That'll be coming out shortly. And then the last part of that handout will be a list of some of the budget items that I think I'll wait till that gets handed out. The bill still contains the removal of the family cap for MFIP, so that women will not be punished because they have an additional child while they're on MFIP. We have the governor's autism language, and about $12.8 million, I think, for improving the care of kids on medical assistance in autism. In addition to that, we have a part of Representative Norton's bill on autism that will require large businesses that buy insurance in the marketplace to have a benefit mandate that does require that kids with autism be covered for the advanced behavioral therapy, whatever. Kim, I think, can explain exactly what that is. Yep. The things that were, let me just run through what's in the bill now very briefly. In addition to those things I mentioned, the HMO advance payment and the hospital advance payment, there were things that came up, including the fact that the Affordable Care Act is going to give us $20 million more than we thought for primary care for 2 years. And so that was $20 million fewer dollars that we had to spend out of our own medical assistance budget. In addition to that, the Commissioner of Human Services decided that the HMOs were charging us in their administrative costs for their advertising. If they had fines and penalties, they charged us a proportion of that as an administrative cost. And if they paid their high-end employees, management employees, more than $200,000, they were charging us for that portion of the salary above that. And included in this bill is the fact that they can no longer bill us for their advertising since they don't advertise for medical assistance. And if they have fines and penalties because of something they did wrong, we don't think we should have to pay for that. And lastly, we think that capping the charges for people over $200,000 working for them is sufficient given the kind of people we are working with. Let's see. The bill does include, I think I'll just, are they handing it out now? Yeah. Okay, in the packet that's being distributed now, I think it's the last page, there is a list of various things that we've spent money on in this bill above the base. And the first one is a nursing home COLA of 5%, and that is about $30 million more that we're sending to nursing homes. 3/4 of that is just a straight COLA. 1/4 of that is based on quality. The governor had things in his approach to nursing homes that put a big reward for quality improvements, and so 25% of that COLA will be distributed to those who meet their goals of improving the quality. As I mentioned earlier, we have a disability services COLA. It's 1% and 1% to the next biennium, and the cost in this biennium for that is $26 million. So we're spending $26 million more dollars on long-term care facilities than the current budget. In addition to that, in the last biennium's budget, they had scheduled a 1.67% cut to long-term care facilities, not nursing homes, just long-term care facilities, and we have eliminated that cut. That was worth to the disability community about another $12 million. We have another item for disability community is we have limited the expenses on TEFRA. TEFRA is a way for parents with a disabled kid to basically get medical assistance for that kid, but there's a payment they have to make based on their income. And for the lower income families, we have completely removed the parents' payment for that, and we have, I believe, a sliding fee for people that are a little bit wealthier. As I mentioned, we have $12.8 million for autism, primarily for people on medical assistance. That was in the governor's bill. He's trying to figure out ways that we can deal with the fact that we have a very rapidly rising incidence of autism in this country. We have put in the bill, unfortunately, I think we had $4 million for sex trafficking, treatment of young girls that have been trafficked, and that we had to give up when we're down to $2 million on that. But I know there's an additional sum in Representative Paymar's committee to train police officers on how to deal with these young girls. In addition to that, we have restored the MERC funding. MERC is a fund that helps hospitals and facilities that are training physicians and advanced practice nurses and other healthcare providers, but it primarily goes to physicians in residency programs, and that was cut in the last biennium. We have restored the cut fully, and in fact we have added an extra $2 million that is specifically for the 3 family practice residency programs that are aimed at training family practice docs for rural medicine. There's one in Mankato, one in St. Cloud, and one in Duluth. We have given, I think most of you probably have that sheet now, we have also given provider increases that go to physicians, dentists, and hospitals. about $10 million additional funding for them. They're getting a 5% increase in the part of our medical assistance program that the state runs directly and simply pays the provider on a fee-for-service basis. So there is additional funding for healthcare providers. We have also put $4.5 million into what's called critical access dental, and these are various facilities that are willing to treat medical assistance people. A big chunk of that goes to federally qualified health centers, or community clinics as they're sometimes called. In addition to that, we have now allowed, and they didn't get it before, but individual dentists that wish to accept medical assistance clients will get a bump in their pay as well. Let's see. Oh, and public health, we had $45 million for the state health improvement plan when we left the House floor. That has been reduced to $35 million, but $40 million would have been a complete restoration of the cut that was made in the last biennium. So we have returned that program basically almost to where it was. Let's see here. And as I said, we still have a $50 million cut to the general fund. What we have done to help reduce general fund spending is there are a number of people that used to be on Minnesota Care that became eligible for medical assistance, and we have transferred some of the general fund money for those people that we used to pay out of the Healthcare Access Fund because they are on Minnesota Care, or at least those that were eligible for Minnesota Care. So we're going to pay for them out of our share of them for them out of the Healthcare Access Fund. Let's see what else. Oh, and finally, we did have language in there that was from the governor when it left the House floor that kept the Minnesota Care Program alive. And as you know, medical assistance was expanded from, depending on whether you were married and had kids or weren't married and had no kids and so on. That program was expanded by the Affordable Care Law, and so that anybody up to 138% of poverty was now covered by medical assistance. And as you know, that most people above 200% of poverty are going to be put into the exchange next year and get government subsidized health insurance through the exchange. But there's a group at the lower end between 138 and 200% of poverty that really won't work in the exchange. So we have kept Minnesota alive. For the 1 year, we need to keep that program because 1 year from now, the federal government will allow us to pay or to have what's called a basic health plan, and the feds will pay at least 90% of the cost of that. So for 1 year, we're going to keep Minnesota Care alive for this group of people, and we have reduced. They used to, in Minnesota Care, they had a $1,000 copay for hospitals. That has been completely removed. For adults without kids, we had a $10,000 hospital cap. And those of you that have been to a hospital know that one night in a hospital can cost you $10,000. So we have removed that cap, and in addition to that, we have made that Minnesota Care program look very similar to the medical assistance benefit package. So that's an improvement for that group of people. We need to keep that going for 1 year till we get the basic health plan. And Minnesota is the only state in the country that has kept a program like this for lower income people, awaiting the announcements of the rules and so on for the basic health plan that the feds will ultimately pay 90% of the cost. So again, Minnesota has taken the lead nationally, and having a state-run program to keep those people with good health insurance. And with that, Madam Speaker, I'd be urge people to vote for the adoption of the report.
Discussion to the Conference Committee report. The member from Anoka, Representative Abler.
Thank you, Madam Speaker and members. And Representative Huntley, I once again enjoyed being with you on the Conference Committee and the process. And, we have a number of philosophical differences, but he's a gentleman, and we've developed a good rapport. And members, we've talked about omnibus bills before, and I made a little joke on my friend Representative Hilstrom, and this is what an omnibus bill looks like, Representative Hilstrom. Actually, the title is 2 pages long. So, sorry. But actually, there's no, I won't get sent to jail by anybody in this omnibus bill, so I have to respect yours. Anyway, well, I'm not going to be voting to adopt the conference report, and so why would I not do that? I think if I just go with a philosophical couple comments, and then we can talk about a few details. And we met till 1:22, Madam Speaker. We broke the joint rule, and I admit that I was a party to that. But Senator Berglund created the joint rule that 1 o'clock really is 5:45 in the morning, and so we were well within that custom and usage of this committee. I said before on the floor and in meetings that I had the curious privilege of being the chairman in the last 2 years when we had the most difficult time in our world of anything. And I've never had to learn to economize and focus as I did in that time. And Madam Speaker, you and your group inherited a much smaller deficit, about 1/10 of that. And you made some choices. But in this bill, some of those economizing efforts and some of those focusing and prioritizing efforts have not occurred. And that would be my biggest singular difference in the approach this bill takes to what I would have done. And I want to point out that that's not meant disrespectfully. We just don't agree on that. And a lot of what got done was simply adding money back into areas that needed some money. There is some reform in the bill that began under my administration and Representative Huntley's administration with Reform 2020, which is a real proud thing we can be celebrating, which is carried forward finally in this bill. And that is going to help people have better lives. And that's a bipartisan effort, but that's not really much of the substance of the money of this bill. The concern that I want to bring to you is the tails. And even though you had a minus $50 million target in the general fund, there was no target in Healthcare Access Fund and in other funds. And so if you do a shift of one payment from a biennium to the biennium, this one, that actually counts as money, and it doesn't show up in your target. If you spend the Healthcare Access Fund down $81 million from $500 million or more that it was, that doesn't count as spending in this target. But I do want to point out that total Medicaid spending in this bill, in a time when you're short $50 million, is $414 million of new spending in the Medicaid program. And so it isn't like this bill doesn't buy anything. And that's a big number. But in the out biennium in 16 and 17, we spent $803 million. Now, why is that interesting? Well, it's paid for in the bill, and Representative Huntley, you balanced, and the Healthcare Access Fund is almost non-existent anymore. Lucky more money will be coming in. And those tails will increase to close to $1 billion by the time the Healthcare Access Fund is repealed. And what you've set yourselves up for, who's ever in charge in 2020, is you may have to keep that provider tax, which we celebrated not having it. Representative Huntley, you and I called it the sick tax at one point. We were happy to see it go. We thought it was unfair to charge sick people for their health care when the people who were well weren't paying. So this bill is actually setting us up for a deficit in the future. And I want to remind members that the spending targets and even the tax levels you've established in the House set you up for a deficit in 2016 and 17. With all the spending you've done, the 2.1 billion, et cetera, the House targets are not far off of what the conference targets are. You're within a couple $100 million of being balanced in 2016 and 17 when you spend all the money and get the anticipated $3.1 billion of new revenue in 2016 and 17. $3.1 billion of revenue is a lot. And so I hope you hit it, because you need it all to pay for the stuff you're buying, including this target of minus 50, which frankly I think is a target I would really wish you would not have done. There's a word I'd use to describe it which might be rude. So but I don't understand the focus that this target gives. I will quote a senator who's not anybody in this room, and Senator Bach said to me in a meeting that, well, if we cut this area, people will see we're being balanced in our approach, and they'll think we're making choices. Well, I just want to remind you the choices you're making here, you're spending $414 million in the Medicaid program, so it isn't like it's lean. But the idea that, and so where the leanness happens isn't in the healthcare side, where you do the expansion. We talked about the ACA expansion, the Medicaid expansion. You celebrated that in February. You celebrated the passage of the ACA/Obamacare and the exchange and all that. But what that does, by putting all that money into this, you starve out the disability side. And Representative Huntley said with his regret that he couldn't hold the House position on the COLA. And so the conference position that will become law, helped out by the governor who succumbed to the pressure of the House and Senate to go lower, is 1%. Now, and I want to remind you that the $50 million target is a target I would have had without raising a penny of tax, minus 50. And so a $626 million deficit would have been kind of easy for us to manage. At least we would have struggled and we would have not liked it, Madam Speaker. But this is a target I would have had without raising a penny. And you all raised $2.1 billion and change, and here you have that. But so what that means is the PCAs that we all care about are going to get about 11-cent raise an hour. Now, 11 cents sounds like a lot until you try to make a phone call. And those dimes don't work anymore, Madam Speaker, and the pennies you'll use, sometimes they're left on the ground. And so it's a matter, so when I make my philosophical concerns about this, it's a matter of focus and how we choose to spend our money. And so the way you do that is you streamline, you do reforms that move people quicker out of places that cost a lot of money, and you make it sustainable. I am concerned that as you pass this bill, and I'm sure you're going to pass the bill, there's a lot of nice things in here you're going to want to vote for. Mental health and doulas are covered in medical assistance. I applaud that. There's an increase for nursing homes to an extent. We'll hear more about that. But what you're setting yourselves up for with all this spending is you're going to find yourself hard-pressed to pay for it in the out biennium in 2018 and 19, and that's really not minor. In addition to that, in taking the Healthcare Access Fund, there's a bunch of sources of money which I find curious. In a time when you weren't going to do shifts and gimmicks, and I'm not going to spend much time on that word, it's such a cool term, Madam Speaker. So the counties are paying $8 million more for an additional share. That's not a reform, although I think maybe they'll be nudged to go a little quicker, moving some people out of my Anoka Treatment Center and out of St. Peter, and so that isn't all bad, but you're just shifting the burden somewhere else. There's some carry forward money of $23 million, which is one-time money. There's some there's some federal money that pops in at $20 million or so one time. There's some surcharge you do on the HMOs and the hospitals that's in the range of $70 to $80 million one time, and there's some federal match you pick up. And so part of the focus in this bill in the past under Senator Bergen and others has been to maximize federal money because it falls from the sky and it's easy to spend. Now the feds have done something called sequestration, which has really affected our Department of Health. And so it's already come back to bite us. So I want to caution you about that. And so I'll try to keep my highlights high and interesting to whoever is listening to this. But I do have some serious concerns. One group I wanted to mention, too, that got especially pounded on, and I've been guilty of that myself in the past, but not to this extent, was the HMOs. Now, HMOs doesn't stand for evil organization that, it's a business. They're nonprofit. In Minnesota, we don't have really any for-profit anymore. We have nonprofits, and they're really actually pretty community-minded. And in this bill, they were treated as though they were an undesirable entity. The process about how some of these changes that happened about their administrative changes was a very short one. In fact, we spent a minute on it in the conference committee. It was all done as kind of a gun to their head sort of negotiation. And in fact, one group in particular, they have not asked me to talk about this. This is all from me. But Preferred One in particular has the least capacity to handle the surcharge payment shift. And they may actually find themselves discontinuing business. That's not for sure, but I'm not sure you meant to do that, and you didn't mean to weaken the HMOs. And why would you want strong HMOs? By the way, you just passed a thing called the Health Insurance Exchange, the MNsure. You want to have strong companies to actually populate that. And so if they're weakened, they're not going to even feel like competing there. And so that's a risk that you're at. Okay, I'm working through here. And there's one thing else, so that was a process that I was really not very proud of, that I was not in the middle of, but I think looking back you might be nervous about that. Something else that happened, there's this drug payment change for Hennepin County and regions and a few others called the 340B. And the department took a very stubborn, unfair position in that, and we passed that off the House, but we really didn't like it all that well. And it wound up in the conference report because I think they needed the money. And I understand that money in the bill is a kind of a gravity thing, but this is going to cause some harm to Hennepin County and regions, and I really hope that the department would look at this again and not be so hard on these really good providers. I don't represent either one of those, but we need them to be strong and intact. And the treatment that those people received at the hands of this really poor process is really bad. I want to talk about some good processes. The same department did wonderful work in the continuing care side, handling the rate setting and the licensing work. Both the Department of Health and the DHS did a really good job. Those are really, really hard and very controversial and put the providers at risk. And I'm really happy to be part of the conference report that fixes that and makes it sustainable for the providers. I'm almost done, Madam Speaker. And I want to just point out one additional group that's at risk, only part ways because of this bill, and that would be the entire disability community. Now, they've been hard pressed in recent years with the reductions that I've even had to be part of. They're getting close to having a hard time staying open. The governor's original bill in 2011 when he raised almost $4 billion, suggested cutting them 4.5%, including nursing homes. At the end of our day, without raising any taxes, we only had to cut them 1.5%, which I thought was kind of cool. The bill left the House without any cut in 2011. I was really proud of that, Madam Speaker. But they have some challenges. One is the small target doesn't give any room to give them a decent COLA, and I don't hold the chairman responsible. I hold whoever sets targets in this room responsible for that. I think it's still a bad idea, and I told you that before, Madam Speaker, and I know it wasn't you. So I'm just telling you it set this up for peril. But in the ACA Obamacare bill, people are required to have insurance if you're an employer. Only about a half of these providers can provide health insurance. And if you're any size at all, you're at risk of paying $2,000 per person for the health care penalty for these people. That's $1 an hour per employee on people who can't afford to give their people a dime. Remember the 11 cents thing? That's the money you're giving them in this bill. And there's no attention given to that. And I don't know how we do it, but we didn't even talk about it, Madam Speaker. Just one other thing, Representative Winkler, I see you're here. We tried to get a carve-out in the bill for sleeping staff in these disability services. So when you go to conference, if you can get a conference, Representative Winkler, if you could pay attention. You got one? Okay, congratulations. So when you're talking there, I didn't know that part. I'm not on the committee. So there's a group called sleep staff, and all they do is sleep. And so if the minimum wage goes up for these individuals, the people who have no money to pay people 11 cents an hour are going to have to find money to give them the first raise. And these people are they're satisfied with this low wage because they don't really have to do a lot. It's kind of a cool thing for them. So just to point that out. But that's another burden on this very fragile part of our economy, which is a lot of workers. And by the way, this the minimum wage also gives them competition problems with other other businesses, like one of your favorite ones, Walmart, and the other and hardware stores and places like that. And they also have increased licensing costs. And so I'm just about done. I just want to say one more thing about HMOs. And I'm a chiropractor. I fight against HMOs sometimes with my work. We're part of a provider coalition that we argue with them. But we still need them, and we still want them to be strong. And if you decide that you don't want them to be participating, there's a rule called Rule 101. So then just cut them loose and let them not have to serve our people. What they do is they bring providers into a network, and then you can organize the care. And I don't want to go on about that. But and also I want to commend the author of the bill. There's some mental health school-length grants, which are really, really important. And there's some good things in this bill that I would love to be voting for. But at the end, we have to be able to pay for all this stuff. And I would hate to be the guy that says in 2 years, I might like that part, where we have to say, I'm sorry, how are we going to pay for all these things we bought this time? And these one-time funding streams go away, the federal money dries up a bit, and the chickens come home to roost on the healthcare access money, which dries up, and then we find ourselves in harm's way. So for that reason, Mr. Speaker and Representative Huntley, I appreciate your allowing me to be in the committee. You were extremely respectful to me as I expressed my views, and I hope I was respectful to you. But I will not be supporting the motion. I urge members to vote no.
Is there any further discussion on the motion to adopt the conference committee report? Representative Huntley.
Madam Speaker, I'd like to ask for a roll call.
Representative Huntley requests a roll call. Seeing 15 hands, there will be a roll call. Seeing no discussion. Oh, Representative Schumacher. Which county are you from? The member from Rock, Representative Schumacher.
Thank you, Madam Chair and members. I would ask you to, I guess now vote red on the adoption of the bill that we have tonight. I would like to thank the committee, the conference committee, for their hard work, and this bill really has come a long way from where it was at when it left the House. But there should be more, and I think if we could not adopt tonight and send it back and start talking about real priorities across the state, and I think you all know what I'm probably going to start talking about here in a moment, that we could really get going and really start to prioritize and work in a way that makes sense for our state. And that, in particular tonight, what I wanted to talk about was in the area of nursing homes. Now, Chair Huntley did talk about the $30 million extra that nursing homes will be receiving this year that they would not be receiving with a zero in their line this year. But the funding in this area is still lacking. The base in this area would have allowed for a 2% COLA for this year and a 2% for the next year, plus the advanced payment systems. And as I said before, when we were talking about this bill and when we were trying to amend this bill before it went to conference committee, the advanced payment systems do a lot of good to allow for facilities to try and do things in the most efficient way possible for their facilities. And this wasn't, again, adopted, but it was part of the base. This was something that facilities 2 years ago could have been planning for. Of course, the APS, the Advanced Payment System, hasn't been brought up hasn't been filled in since the time that I was in about 7th grade. And so it's been just a few years since we've actually funded that. But I don't think this is a time when we're raising taxes by over $2 billion and spending nearly $4 billion more. This is not the time that we put that on the back burner once again. And so I was really disappointed to see that had we gone with just what the base had offered, there would have been $46 million new dollars going to nursing homes this year. And instead, this bill offers only $30 million in new funds for nursing homes this year. The Long-Term Care Imperative handed out a sheet tonight thanking the committee for their work, just like I thanked the committee a little bit ago. It is better to have 30 than it is to have 0. And of course, if the Long-Term Care Imperative were to come forward today and say, well, thanks for the $30 million, but we'd like some more, they'd seem ungrateful, and that wouldn't be the right route for them to go either. And so it doesn't surprise me that they would say that this is the right route to go. But folks, members, this is just not enough for what we're trying to accomplish here, and the need that's really out there isn't going to be fulfilled with this. The same thing that Representative Abler had pointed to before with the home and community-based services. When I left the House, we were at a 2% increase there, and here we have a 1% to deal with now. So we're looking at $30 million going to nursing homes this year when the base level would have allowed for $46 million to be going in. And I'm sure that if there's willingness to have a little bit of discussion tonight, there's going to be questions about why the Republicans are complaining about the lack of funding in this area and why why we didn't do more in our time here. And we heard the debate last time. We heard the comments last time that the Republicans didn't do a rate increase for nursing homes last time either. So where are we to stand and complain about these things? And it made me think about this book that I'd been reading from Erich Fromm, who was a philosopher during after World War II, who spent some time in Nazi Germany and tried to think about what motivated people in life and what drove people to have the types of lifestyles that they had. And he found the types of authority that people would need in order to not have to make decisions and have a government authority make those decisions in there. And one of the things that he said that was very striking to me, and the debate that we're having tonight, and when people say, well, the Republicans didn't fund nursing homes either, so why should we feel bad for only doing a little part? And what Erich Fromm had to say was, he asked the question of who could riot against the invisible? If you're just going to stand behind the sidelines and just blame the other side for everything, who could riot against that? Because you're no better or worse than the other person, so why do that? You don't need to be a leader in this. He also asked, who will protest the nobody? Who will protest the nobody? And if you're not going to stand up and really put yourself out there to make these changes, if you're just going to say, well, other people did it the same way, you're really standing up for the nobody there, and no one will protest you, so that makes it easier. It kind of brings forward to the thought that everyone is at fault, so no one's to blame. It's a moral safe house. Unfortunately, members, the difference is this. 2 years ago, the Republican legislature had a $6 billion deficit to deal with, and we were able to increase the lowest rate nursing home receivers by 3% because we made it a priority for the state of Minnesota. This year, the DFL legislature will spend $4 billion more, and the nursing homes will not even meet their base increases. So taxes are going to go up by probably about $3 billion with fees, and our nursing homes will only be slightly less vulnerable to closing next year than what they are this year. Only slightly less vulnerable. But who can riot against the invisible? So I guess this makes this a politically safe but a prioritary poor provision to vote for today. We should be prioritizing and reforming in health care so that we can make sure that these funds get taken care of the way they should be. Another point that I think is important to be talking about tonight is the cost shift that goes from the state to the counties in this bill. Over $8 million in changes this year will go from the state share to the county share. And those costs for the Anoka Regional Treatment Center and the Minnesota Security Hospital in St. Peter will cause the local tax base to have to pay more. Those are funds that the counties are not currently budgeting for, and so they'll need to be making adjustments to that. And I would like to see that fixed, and that's why, again, I would ask for no adoption. So members, unless you want to be invisible, unless you want to stand up for the nobody, I would ask you tonight to not adopt this report, to please vote red, and let's send this back to committee so we can work on prioritizing and doing better for the people in our state. Thank you very much.
Any further discussion on the motion to adopt the conference committee report? The member from Rice, Representative Fritz.
Thank you, Madam Speaker. And I rise, members, to ask you to adopt the report. And also to say, Joe, say it isn't so. What happened to you? You and I were out here on the steps with the care provider people a week or week and a half ago giving the high fives for the 5%. And now here you are saying it isn't enough. What on earth? I can't believe my ears. I cannot believe Representative Abler, myself, who has been at this for many more years than I have. I've been at this for 9 years, but personally I've been up here testifying for rate increases for 40 years. You cannot turn and snub your nose at a 5% rate increase for our nursing home workers who care for our most vulnerable adults. You must rethink this, Joe, and all of you must be very pleased that we have 5% rate increase. One time, it's not enough, but it's a 5% increase. 75% of that is encumbered for wages. This is a good deal. It's a step in the right direction. This is the entire state, the Iron Range, southern Minnesota, eastern, western Minnesota out there in your nursing homes. Representative Gunther, you and I, we've talked about your nursing home. They were going to close 43 of them in the near future. They won't close this next year. And we'll come back and do some more work. Please vote to adopt this.
Discussion to the adoption. The member from Sibley, Representative Gruenhagen.
Oh, thank you, Madam Speaker. Thank you, Madam Speaker and members. Would Representative Huntley yield, please?
He will yield. Representative Gruenhagen.
Yeah, Representative Huntley, this is my understanding, and I've been trying to find it in the bill so you can clarify it for me. But my understanding, it's a 5% rate increase for nursing homes. However, there's a property rate increase also, and the net amount, rather than $30 million, is actually about a $13 million increase for nursing homes. Once you take away the subtractions from the additions, am I understanding that correctly, or do I have that incorrect?
Representative Huntley.
Madam Speaker and Representative Gruenhagen, they haven't received that for years and years and years.
Representative Gruenhagen.
If Representative Huntley would continue to yield.
He will yield. Representative Gruenhagen.
And what is the amount they're not receiving?
Representative Huntley.
My understanding from my colleagues is it's $25 a day.
Representative Gruenhagen.
And what does that total in terms of millions of dollars for the year? Do you have an idea?
Representative Huntley.
Madam Speaker, Representative Gruenhagen, I really don't know.
Representative Gruenhagen.
Well, members, my understanding again, and I don't have complete clarification on it, it's when you subtract that property rate increase versus the new funding, the nursing homes are actually getting a net about $13 million, or about a 2% increase. So I just want to, we can say it's going to be $30 million, but I think that there's some caveats to that. The other question I had isn't the on the tails. My understanding is the next biennium with the spending of one-time money. And by the way, when I was on the school board, I always opposed the spending of one-time money on ongoing expenses. If you did that in your private life, it's the quickest way to go bankrupt. Take one-time money and apply it to ongoing expenses. If you, again, do that in your personal life, you'll be declaring bankruptcy in a few years. Unfortunately, that's the way a lot of government agencies work. Apply one-time money to ongoing expenses. But my understanding is the tails in this bill, because of using one-time money to pay ongoing expenses, is about $800 million. Is that correct, if Representative Huntley would yield?
He will yield. Representative Huntley.
Madam Speaker, Representative Gruenhagen, the tails don't go up one penny. And I will say, you talked about one time. We have a one-time problem, and that's waiting for the basic health plan to be implemented 1 year from now by the federal government, which will reduce our spending significantly.
Representative Gruenhagen.
Yes, Madam Speaker. Would Representative Abler yield for a question?
Ah, there he is. He will yield. Representative Gruenhagen.
Where? Oh, he's right there. He's hiding from me. Representative Abler, would you explain the tales that you see in this bill? Is it closer to 800 million?
Representative Abler.
Thank you, Madam Speaker. Representative Gruenhagen. There's two different kinds of tails. One is the general fund tails, which is a zero in this budget. If you look at the top of the spreadsheet, and by the way, human service spreadsheets are fascinating. They're good to take you on vacation. But anyway, the line 7 is a general fund sheet. It's the general fund thing. If you look at the 2014 and 15 column, which is to the right of the conference, it's 50 million reduction. And then the far right column is a zero. However, if you look at line 36, that's the summary of medical assistance changes, and that's increased spending that is in the bill, and it's from any source at all. And generally, it's the Healthcare Access Fund is the largest single source of that. And if you look at the far right column, the tails on this total spending are $803 million. There's a lot of interactions, and I don't even understand all the way they work together. But this is spending requirements that have to be carried forward, and they're funded both by the Healthcare Access Fund and those one-time expenditures, plus surcharges on the DD places and some other funding.
Representative Gruenhagen.
So there you have it, members. One person said the tails are zero. The other said it's about 800 million. So I guess you have to pick the figure that you want to work with. Okay, but there's obviously some smoke and mirrors here that I don't think are going to completely work in the long run. And so, members, I would think that we should vote red on this and send it back to conference committee. Thank you, Madam Speaker.
Representative Huntley.
Madam Speaker and members, the tails that we have are the exact same tails that you left us at the start of this year. Not 1 penny more in my tails than what yours were. Not 1 penny.
The member from Brown, Representative Torkelson.
Well, thank you, Madam Speaker and members. I'm going to have to ask the members to vote red on this bill, and I'm going to focus on just one area. It's an area that Representative Huntley focused on in his opening remarks, and that's the folks that take care of people with disabilities in our long-term care facilities all across the state of Minnesota. This bill left the House with a 2% increase. Well, 2% on a $10 wage is 20 cents an hour, but that seems like it was way too much. We had to cut that in half. They're down to a 1% embarrassing increase. These folks are great folks. They come to the Capitol. They visit my office. They plead with me to do better for them. I do what I can to encourage state government to do better for them, but it seems like we can't find in an $11 million budget, we can't find a few $1 million to help these folks out and give them a decent increase in their wages. Would Representative Huntley yield for a question?
He will yield. Representative Torkelson.
Thank you, Madam Chair. Representative Huntley, I got some emails this morning from folks that work in this area. One gentleman has been working in this area for 20 years, and he doesn't know if he can afford to keep on working because he has a family to support. Representative Huntley, what do I tell this gentleman and others that work in this industry? What can they expect in the future?
Representative Huntley.
We are increasing spending, Madam Speaker and Representative Torkelson. We are increasing spending at least $50 million on the care and for people with disabilities. That's a lot more than you ever did. We're not cutting them. We're giving them more money. I would also say you should read the letter from the Long-Term Care Imperative, which supports this bill. You should read the letter from the Association of Minnesota Counties, which supports this bill. You should read the letter from the county-based purchasing entities that supports this bill. You should read the letter from ARC of Minnesota, which supports this bill. You should read the letter from the Minnesota Disability Law Center that supports this bill. You should read the letter from Legal Aid of Minnesota, which supports this bill. All those groups are dealing with people with disabilities, and they're all supporting this bill.
Seeing no further discussion, the member from Cottonwood, Representative Hamilton.
Thank you, Madam Speaker. Representative Huntley, you should read the letters that I'm receiving from the people who work with people with disabilities. You know what, my friends, you're right, Representative Huntley, and so is everybody else. We haven't done this area justice. I don't care if it's Democrats or Republicans. These are people that care for people with disabilities. And we haven't addressed the needs. We haven't addressed this. And this year, my friend Representative Torkelson said it, we're increasing taxes and fees by over $3 billion. You know what? Representative Fritz, thank you for what you said about nursing homes and nursing home funding. I'm proud of that. But the fact that we're not helping out people that are working with people with disabilities, that's alarming. And like I said, I understand and I will read the letters from all those people that you mentioned, but I'd like you to read the letters from the folks that actually work with the people with disabilities as well. Thank you.
The member from Douglas, Representative Franson.
Thank you, Madam Chair. Hello? Okay. I'm going to stand with my Greater Minnesota colleagues and oppose this bill as well. Members, 1% for our disability community, our constituents here, is not appropriate when we are raising over $2 billion in taxes and fees and balancing the back of the budgets on smokers. You know, the majority said that they were going to fund priorities, and by looking at it, I'm not seeing the fact that the disability community is a priority of the majority. And so, members, I ask that we do not adopt this report, send it back, because I believe that we can do better. We've got tons of wasteful spending going on in the current budget. I believe we can do a little tweaking here and put the money back into a priority, which would be our disability community. So, members, I ask that we do not adopt this, and like I said, send it back. Let's do a better job. Thank you.
The member from Polk, Representative Keel.
Thank you, Madam Chair. I, too, need to speak up. My development DAC director has contacted me many times. She happens to be a good friend and reminds me quite often how hard it is to provide good staff, and a 1% increase is just a shame when they work so hard on the disabled. When I went to visit them, they were busy making different projects to sell so that they could supplement their business and take care of all of those who are disabled. So, members, I too am not supporting this bill.
Discussion. Seeing no further discussion, the clerk will take the roll on adoption of the conference committee report. The clerk will close the roll. The motion, there being 73 ayes and 57 nays, the motion prevails. The clerk will give the bill its third reading as amended by conference.
Third reading, House File 1233, as amended by conference.
Third reading as amended by conference. Discussion. Representative Huntley.
Members, there's been some talk about the long-term care things, and I would like to read from the long-term care imperative. This bill also includes a 1% increase plus a quality aid payment, both available at the end of fiscal year 2015. This will be the first increase in EW providers in the past 5 years. Madam Speaker, members, I've been here 21 years, and this is the first time I've ever been accused of not spending enough money.
Discussion. The member from Dakota, Representative Mack.
Thank you, Madam Speaker. And members, I want to take the time to thank Representative Huntley. It was a pleasure serving on this committee this session. It's always a huge learning experience serving on Health and Human Services Finance. And just a couple things I want to point out. I am particularly grateful that funding for Teen Challenge was put back into this bill. I know that was a concern for many of us, and so I want to thank. I'm trusting. I know that you're a huge advocate for that program, Representative Huntley, and so I thank you for whatever you were able to do to make sure that that got back in there. I am disappointed that the return on taxpayer investment appropriation for $100,000 for that study didn't get in there. I think that that would be a really good move for taxpayers and accountability in our system, and I'm sorry that that did not survive the conference report, and hope that that can be considered in the future for the small amount of money that it would cost and the huge return that we could potentially see for taxpayer investment dollars. Members, this spreadsheet is obviously very complicated. There's a lot of numbers. It's a lot to comprehend and digest in an evening. But I want to just echo, I guess, Representative Hamilton pointed out. I've been getting emails all day long from
members. If you could take your conversations off the House floor into the retiring room or the alcoves. Some members are having difficulty hearing Representative Mack. Representative Mack.
Thank you, Madam Speaker. Members, just wanted to point out, I don't know how many of you are getting these emails from people today, but I've gotten several from the folks that are working. They spend very long days and nights serving the vulnerable, disabled, and elderly in our communities. Disappointed to see what came out in this report in terms of the 1% increase for the work that they do. And members, I would agree and echo that this is an area that we could all do better in, no matter who's in charge. And I know a lot of us get exhausted of the pointing fingers and the blame game and the pointing back to 2 years ago or 4 years ago or 6 years ago. And I truly don't think that that's productive for our discussions moving forward. But members, I do think that there is something to highlight here in terms of the fact that, yes, we are giving increases, much needed increases. Whether you agree with the amount or not, you can debate. But I think you have to keep it in the context of the overall budget that we're looking at, and that is the fact that we are raising taxes significantly in this state on hardworking Minnesotans by upwards of $2 billion, close to $3 billion when you take in all the fees. And members, when you compare that to what this bill is doing and what it's showing to our disability community and the folks that are helping out our elderly, it just doesn't make sense, members. It doesn't, I think, reflect the priorities that we all talk about in this room, we all talk about in committee. And so, Representative Huntley and members and the people that have worked very hard on this, I understand that these are increases that are desperately needed, that have been asked for, that are maybe in the case of the nursing homes are maybe higher than some of us were thinking they'd get to a few weeks ago. And that is appreciated, but I don't think we can take for granted that you have to take it in context of what we're doing overall in our state budget. You can't just look at this HHS bill in isolation and say, look at us, cheer for us. We're doing better by the disabled community in our nursing homes this year for the first time in a long time. And comparing it to what was done 2 years ago in an impossible situation of a $6 billion deficit and what the decisions that were made on behalf of this community. And so, members, I think we have to be honest with ourselves and looking in the mirror at what this looks like in context of our overall budget. And I think that is disappointing, members. Again, I want to echo that I do appreciate some of the good things that are in here and a lot of the things that I do support, want to vote for, know that my county supports, various folks that I have seen in their facilities that I've toured, things that they like, some of the small reforms, some of the big reforms that are moving us in the right direction. But unfortunately, members, there's a lot in here that I think is a mispriority. And so with that, members, I would urge you to not support this conference committee report. Thank you, Madam Speaker.
The member from Otter Tail, Representative Nornis.
Thank you, Madam Speaker. Just wanted to take a minute to address this bill and to actually thank Representative Huntley for the work he's done. When this first came out or was talked about, and that surcharge was in there, my local hospital really had a difficult time. And it represented over $600,000 in cuts they were looking at just to pay for that surcharge. So thank you very much for removing that, because that's a big deal for our independent rural hospital that's in my district. The part I'm disappointed in is the target that you received. I understand how difficult that must have been. My nursing homes, I have 5 left. I lost 2 of them this year. I have 5 left. That's probably the most critical thing now that I see in the future that's affected by this bill. And the little that's being done, I'm not sure that's going to be enough. I also had 2 nursing homes that are in direct competition with the Veterans Nursing Home. We tried to do something a little extra for them so that in fairness, the reimbursement rates would be pretty much on par. And that was not successful. So a lot of work done, and I appreciate all of the members of the Health and Human Services Committee. It's a lot of work, but again, this bill is not up to par for me, and I'll have to vote red. Thank you.
The member from Anoka, Representative Lane.
Thank you, Madam Chair. Well, there are many good things in this bill, and I will be voting green. However, I want to speak for just a minute about how we deal in this bill with our HMOs. I was very glad that we have listened to the serious concerns from the Commerce Department report about how the HMOs were claiming, what they were claiming for their administrative costs as they came to us each year to develop the contract on how we would pay them to administer our public programs. It was outrageous that they were including advertising costs in these costs when there is no advertising involved in administering the public health programs. And administrators' compensation that was ridiculously high, possibly shifting some of the cost of administrating their private insurance programs, and charitable contributions that they made, and penalties or fines assessed against them. Thank goodness with these bills we will no longer allow these administrative expenses for rate-setting purposes. However, after the Commerce report in December came the Siegel audit this spring. It clearly laid out that the HMOs profited well from the public programs, receiving more than $300 million over 10 years beyond the profits, the targets that we had set for these profits. These are our public tax dollars going to assist those who need our public health programs, administered by entities we created to save us money, assuming it would be cheaper than it was when we administered these programs ourselves. And we established them as nonprofits in the state of Minnesota to help it be cheaper than doing it ourselves. Part of the problem here, as determined by the Siegel audit, is that the HMOs did not provide to us what we would call paid encounter data, so that we could actually see what the public health programs were actually costing them. Hence, we could pay them for their costs, plus reasonable administrative costs, plus a bit more for profit, which is what goes into their reserves. So we had self-reported information, lack of clarity about what counts for administrative expenses, and the HMOs telling us how much money they needed to carry out our program requests. This has been going on far too long. The formula used for rate setting with them became further and further out of whack. The Siegel report clearly establishes we have been paying more than what is reasonable. So into their reserves went all this profit. When we created HMOs in the early 1980s, we said, as nonprofits, they did not need to be banking up reserves. So we set a cap on the maximum reserves. That cap was quietly removed in 2004, and the reserves have been growing unreasonably since. One of the ways to get a handle on all this is to return to reserves cap. That is what we intended to do in the original HHS bill. Now I see only a study. A study, members. We don't need a study to determine whether we need a cap. We don't need to be advised by the HMOs themselves as to whether they need a cap and at what level it might be. That's what the bill says. This is the very thing that's gotten us into this situation now, the HMOs telling us how we should interact with them. These are our public tax dollars that sit in the bulging reserves right now. It is not a study we need. It is a cap on reserves. And I, with others, will be continuing to work for this outcome in the interim and next year. Thank you.
The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker and members. Well, members, this conference report, just like all conference reports, is of course the result of negotiation. And in a negotiation, you never get everything that you want. And I think that this is a very, very good bill, considering all of the pent-up demand that we've had in the state and all of the many needs. And of course, we all regret the needs that aren't met, just as we celebrate the needs that will be met in this bill. But I do want to just, as so many members have talked about the disability community, and of course, as Representative Huntley mentioned, we would like to have done better for those who are serving our most vulnerable people in long-term care facilities. However, there are some additional benefits in this bill that are going to be very, very helpful to various groups of folks who are living with disabilities. And one of those I'd like to mention in particular is some new dental benefits that will be available for our disabled folks who have special dental needs. Now, one of the things that I discovered in my own community, and this is actually a bill that was carried by Representative Norton, it's something that we have been working on for a while, is that some of the people who are living with severe disabilities have particular difficulty getting dental treatment. Even though their treatment is covered by medical assistance, they are folks who are unable to sit still in a dental chair, or who, it takes particular amount of coordination to cooperate with a dentist and get the treatment that you need. Many of these people had to be transported great distances using special vehicles in order to get to a dentist who could handle their needs. And so one of the things we have in this bill is special coverage for some of these folks who need things like sedation in order to get the treatment that they need, or behavioral management services, or having additional cleanings because they're people who can't take care of their own teeth. And as we learn and understand more about health care, we know that the condition of a person's mouth is really important to their overall health. So this is really a very special thing. It's about $1 million in this bill to help provide this additional care that will really improve the lives of many of these people. And it will save time in the facilities. It will save staff time, because we won't any longer have to send a staff member in a van with a very disabled person a great long distance to get treatment for their dental problems. We can have dentists. We've got some very good dental providers who go to the facilities where the people live, and will now be able to be reimbursed for providing the care that these people very much need. In addition, I think we would be remiss if we didn't discuss here some of the important advancement we've made for children with autism in this bill. And maybe Representative Huntley mentioned this, but there is in the bill almost $13 million to provide a new dental benefit for children with autism who are getting medical assistance to try to identify them earlier and get them the services that they need, which can sometimes result in heading off a lifetime of disability if we intervene early and give them proper intervention and treatment and services. And in addition, there is also in the bill, although it's not a cost item, an attempt to help those families who have private insurance who have had their autism services dropped by their private insurance. So this is going to be of enormous benefit to many people, and those in the autism community who've been working very, very hard to advance these services are really thrilled, although they know that there's further to go. This isn't perfect, but we know that autism is a growing problem. It's a terribly difficult problem for these families who are struggling. We know it's a growing problem. We know that it's probably going to continue, and providing the right services at the right time for all of these families, whether they're low-income families on medical assistance or higher-income families who have been buying their own medical insurance and then finding out it didn't cover the services they need. This is a tremendous step forward. So If only for this reason, I would be voting yes on this bill.
The member from Olmsted, Representative Quam.
Thank you, Madam Speaker. And members, if you haven't served on either of the HHS committees, it's quite an experience. As a freshman and now coming back, you see and hear about a lot of people in the state that maybe don't get noticed but have great needs. They have situations that it tears at your heart that you can't, do more. And when we talked over the bills, the options, etc., in committee, there were at least a half dozen or more amendments towards the end where everyone on the committee agreed these are great things, these are things we needed, and we just didn't have the dollars. And when I heard that it was improving by $100 million, I said, well, maybe we can finally do these other items, and I was disappointed that some of them didn't make the cut, so to speak. And some of those hit home with people that were sending me emails about their situations. See, you've got options in the larger cities in the metro, but when you are in rural or greater Minnesota, often you have very few options. And there are some of these in-community services that you might not think increasing a fee here or another expense by a few $100s and etc., but they don't have much of a margin. And I think, unfortunately, we didn't give enough attention to the fact that everything's not created equal. If you have to drive farther or you don't have access, there are additional costs or a lack of options. When you have counties where the average age is reaching towards retirement, and you've got a high percentage of services to the general population, even though you have more than average of people volunteering, it's not enough. And frankly, I don't think we look at greater Minnesota for some of the unintended consequences when we do these large bills. It is so hard and complex to put together 3, 5, 700 pages of a bill, and the interaction that frankly we need to hear from our constituents in these letters and feed that back in. And I just wish that, especially this conference bill, the report and stuff had come back with a few weeks so that we had the opportunity to have it percolate out and then come back to get a fuller view. I mean, looking through it, I noticed several things that we had discussed in committee that we would have loved to have done that weren't. And I don't want to take up the many hours to go over the details, but frankly, I'm a little bit disheartened that things that were $500,000 or $1 million or $2 million that we really felt were good programs didn't find their way into the bill when we had an extra $100 million. And I guess disappointed with the end result. These are never easy, and I must say to the chair of the committee that he's done a very good job with a difficult task, and you're never going to make everybody happy, but frankly, I don't think we did a global view with Greater Minnesota in mind when we made some of these decisions. So I frankly can't support the bill as a whole. And I just wish that, again, we had the time to where I could share. I must have had 3 dozen emails today from people who had either relatives or they worked in a nursing home or an adult care facility, and they've got specifics. A lot of the bills we do don't have the impact to people's lives and the quality of life that this bill does. And if I could make the rules, I would say that once we had targets, that the priority would be to do this bill first, give it the time, and allow us to have the full discussion that it needs. Because when it comes down to your neighbors, your families, and your communities, that's not a partisan issue. And if you would listen to the debate that we had at the end of committee with all these programs, I didn't hear much partisanship. I heard a lot of compassion and a lot of people that wished we could do a better job. And frankly, feeling rushed is not doing a good job or the appropriate job. So if any of you are involved in setting the goals, the rules in the future, please consider that not all of these spending bills can be done at the end and done with good measure. And please, next time around, keep in mind that we should put this bill and the welfare of the people across the state at a higher priority in the schedule than many of the things we've debated. You know, every bill is important to someone. This bill is important to everyone in the state of Minnesota. It touches every family and almost every life. And to me, that's a priority above, I think, almost every bill that we've debated this session. So I'm sorry that I don't have a silver bullet. I'm sorry that I don't think we have the time to give. I just want to have you think about the future, because this is not the end. And I wish so much that we could do more. But thank you, Mr. Chair, and the members of the committee for all the work on a tough situation. And I'm glad that there's more money. I just wish it reflected some of the discussions we had that last week of where that extra money would go.
The member from Wabasha, Representative Drazkowski.
Thank you, Madam Speaker. If Representative Liebling would yield for a question.
She will yield. Representative Drazkowski.
Thank you, Madam Speaker. Representative Liebling, I think you'll recall when this bill passed on the House floor initially, we had a series of amendments, at least 2 of them that I remember very clearly. One of them was an interaction between you and I developing a very good hybridized amendment that provided for both drug testing for welfare recipients and for legislators. I understand also, Representative Liebling, that some form of that amendment also passed in the Senate. Can you tell us why we don't see it in the conference report, or am I missing it in this 700-page spending bill in front of us?
Representative Liebling.
Thank you, Madam Speaker. Well, Representative Drazkowski, there was no Senate version of that to my recollection. It was purely a House position, and there wasn't support for maintaining it in the conference committee. So without support, in fact, I don't think the Senate had any support for it at all. But I did vote to maintain the drug testing for legislators, but I think my vote might have been the only one.
Representative Driscoski.
Thank you, Madam Speaker, and thank you, Representative Liebling, for your sole vote. I would have hoped that we could have the rest of our House delegation vote likewise. We, I think, passed that measure very handily through here. It was a very high number of votes, and it's just a shame that we don't see it in the final conference committee report here, because that amendment and there was another related amendment, but those provided for bringing forward some responsibility in how we spend our money, and also actually bringing forward some compassion about how we deliver the dollars that we do to folks that are on welfare, and helping actually find a way to get that money to the kids who need it, rather than to into the bloodstream of addicts in another form that we don't want it to get into there. Members, I am going to be voting against the bill. I'm very concerned about our inability, realizing for several reasons. One, we are increasing taxes by about $3 billion, increasing spending by $4 billion, and we don't have the wherewithal to figure out how to fund what I consider to be one of the priorities of government, and that is taking care of people who truly cannot take care of themselves. If we don't have the wherewithal to adequately and properly fund the people who take care of our elderly residents in nursing homes, and to take care of those who care for our disabled folks throughout Minnesota, we are not fulfilling our responsibility as a legislature to set the proper priorities. I find that very interesting and also very frustrating on behalf of Minnesotans when we are giving 6% salary increases to judges throughout the state that make $129,000 a year, a $7,000 to $8,000 increase in salary for them, but we can't give a 4 or 5% increase for the people who work for our disabled services throughout Minnesota. We also need to remember that we are constructing for the next biennium a liability of $330 million of additional salaries to public employees. That's on top of the commitment that we had in this biennium and the additional spending, the COLAs that went into all of those. We have to remember those state employees are already paid 70% of those classifications at levels that are higher than the private sector. Many of those salaries, if I remember correctly, last time I checked, over 4,000 of those nearly 50,000 state salaries are over $100,000 a year. My guess is today it's in the neighborhood of 5,000 state worker salaries that are over $100,000 a year. And members, we don't have the wherewithal in our ability to set priorities to fund the people who take care of the people that should be our priority in this state. And you're right, Representative Schoen, we should take care of those folks that take care of our disabled folks and those folks who take care of our nursing home residents. We should have done it differently. This is a wrong bill here today. It's a wrong bill for Minnesota. Members, we should have sent this back to conference so that they could have reworked it. And I think Minnesotans are going to be disappointed with the product that we finally came out, especially realizing we are going to extract $3 billion from them and spend it on things that are not the priorities among which this member should be the number one. So I thank you, members, and thank you, Mr. Speaker.
Representative McDonald.
Thank you, Mr. Speaker. See, here's the stark contrast between the Health and Human Services bill that the majority, the Republicans, put forth 2 years ago. Close to 350 pages. Our health bill, thanks to our chairman, Jim Abler, was approximately 300 and some pages long. Today, Representative Huntley's bill is over 702 pages. Now, what difference does that make? Well, I'll tell you what it makes briefly, and I won't make this long. Health and Human Services is very complex. We spend over 33% of the budget on our health and human services to take care of our elderly, our disabled, our poor, our sick. And by the grace of God, that is our work. That is what we are called to do, in my opinion. And Representative Huntley, you did your very best. But we had even a tougher task of balancing a $5.2 billion deficit. And Representative Abler had a very tough target to hit, as you did as well. But we made very tough sacrifices to ensure that we did not neglect those who were in most need, those who were most vulnerable, those who were sick, those who were poor, those who were folks that we said were our priorities. So, out of 302 pages, for you freshmen who weren't here, 302 approximately, don't quote me exactly, approximately, the savings and the reforms that we created saved the state of Minnesota over $2 billion. Folks, $2 billion. The proof is in the pudding. You've seen MMB's results. We've had some surpluses, and a lot of that is due to good work from you as well, Representative Huntley. You and Representative Abler worked together on hard reforms. And you know what's really tough? It's easy to raise taxes. It's easy to spend other people's money. It seems to be, at least on your side of the aisle, certainly not ours. But it's hard work to offer real reforms, especially in health and human services. And because of that, $2 billion savings to the taxpayers of Minnesota today, and if we're on the same course, the same trajectory, lest this bill gets passed tonight, a savings of $13 billion in the next 10 years from the savings and reform in health and human services. I think that's worth repeating, so I'll say it again, because I said it over and over again in Wright County, because health and human services is a very complex committee. I was on both committees, Reform and Finance. But what I did take away from that was we did save, and on the course of saving for the reforms in health and human services by getting more bang for our buck in the programs and MFIT and our health care and MA and all Minnesota Care and all of that, $13 billion savings in 10 years. Well, if this bill passes, Representative Huntley, $6 billion of that will be lost, approximately. We'll only have a savings of $6 billion. So there's the stark contrast, folks. 702 pages of your bill tonight, if you pass it, whereas ours was around 300 pages long, and not one person was neglected. Now you argue perhaps that we didn't pay the increase in nursing home very well. Your 5% is clearly not enough, but you're only facing a $687 million deficit. We had a $5 billion deficit. So if there's any takeaway, folks, and I'll reiterate my point and sit down. 702 pages and no savings to the state of Minnesota. $600 million more than our budget bills, our HHS bill from 2 years ago. $600 million more. And yet, we had a $2 billion savings, and we're seeing that today. Savings to the taxpayers of Minnesota. So folks, Representative Huntley, you were a great chairman, respectful, admirable, and I enjoyed serving under you, but I unfortunately regret I cannot support your bill tonight because it doesn't do enough for the hard-working taxpayers and to help the most vulnerable, and especially our nursing homes in the state of Minnesota.
Representative Liebling.
Thank you, Mr. Speaker. And I rise a second time. First of all, I just want to respond to Representative Drazkowski on this drug testing thing again. And I don't want to rehash the whole debate, Representative Drazkowski, but every time you get up and repeat this mythology about people on welfare, I just have to respond because it just shouldn't go unanswered. There is no evidence that people who apply for welfare use drugs at any higher rate than anybody else. And the state of Florida found out when they tried to do this very thing, they lost money on it. It doesn't save money because it costs money to do the tests and the return on it is very, very small. So I just want to put that out there. Then I also want to make sure that members remember when Republicans want to talk about how wonderful their bill was and how you didn't leave anybody behind, remember, part of what this bill is doing, at least almost $13 million, is buying back a cut, 1.67% cut that would have gone into effect at the end of this biennium to these very people that you're all so sorry for now. And I realize that, I don't doubt your sincerity, But the question is, when you were in charge, what were you willing to do to take care of these people? You weren't willing to raise 1 penny more. I seem to remember this constant refrain, not a penny more. It didn't matter who needed the penny. And certainly these people did, and they were panicked when we came into the majority. People were panicked about the cuts that you passed that were going to come into fruition. And that is part of our budget. And remember the relative personal care assistants, people who are caring for their own relatives, and you gave them a 20% cut in your budget, and that's not here in this budget because it's already been bought back with some savings the administration found from the HMOs last year. But you made that cut too. That was a terribly painful cut. So Representative McDonald, you want to talk about how nobody got left behind. You know, the only reason is because we were willing to raise a penny to help out the folks before your cuts hit them so badly. So I don't think we can, obviously we all want to do better. But the real question is who's willing to do something to make it better. And although we haven't gone as far as I think a lot of us would like to go, I think people's lives will be better under this bill than before. And certainly that's going to be true of many people with mental health problems. It's going to be true of many people, many families who are struggling with autism, many families who have issues with disabilities, because another thing we've done in this bill is to reduce what are known as the TEPRA payments that families have to make. And for some, those payments will go away altogether for the lower income families. So these are families of children with disabilities who are paying a fee to the state to get services that they absolutely need, in addition to paying for their own private health insurance. So there is a lot in this bill to help folks with disabilities, and the Republican majority did not help these folks. And sure, you had a difficult budget situation, but part of that was of your own making because you decided to handle it with cuts only. Of course, at the end, you did do some borrowing as well. But when you have a cuts-only budget, what do? You make cuts, and you cut. And that's how you decided to handle Health and Human Services, just like everything else. And we are here trying to meet a lot of unmet need and make things better for people in this state.
Representative Dowd.
Thank you, Mr. Speaker and members. Democrats proposed one of the largest tax increases in this state's history, and in the same breath you have the nerve to cut funding for our most vulnerable Minnesotans by $50 million. In fact, Democrats are handing out raises to every single budget area except Health and Human Services. Over $2 billion in new taxes and over $300 million in new fees. And instead of providing stable funding for long-term care providers, you want to rely on shifts and gimmicks. Democrats use a gimmick that enables the state to collect 3 months of surcharge payments earlier, allowing them to add $36 million to their books on a one-time basis. That's a gimmick, members. Today we face a much better budget outlook than we did 2 years ago. The Republican budget we passed 2 years ago made nursing homes a priority. Why aren't you prioritizing nursing homes and the disabled? Members, this is unacceptable. Vote red. We can do better.
Representative Murphy.
Thank you, Mr. Speaker and members. I want to begin by thanking Representative Huntley, the Chair of Health and Human Services, the members of the Health and Human Services Committee and the conferees, and Representative Abler for your able work on this issue tonight and throughout the session. And I want to thank you for bringing to us a good bill for Minnesota. This HHS bill sets priorities and it makes difficult choices in order to reduce spending by $50 million while increasing funding for nursing homes and caregivers, a 5% increase. It's good for Minnesota in every corner of the state. And it's a far different HHS bill than the one that was passed under your leadership, the GOP leadership, 2 years ago, that included over $200 million in cuts to the elderly and the disabled. Your choices and your priorities 2 years ago undermine the credibility of your argument being made tonight. But the argument is both entertaining, a little surprising. I've had a hard time believing tonight when I heard the speeches because I remember what you said yesterday when we unveiled our tax bill. Yesterday you said, no, we can't increase taxes on millionaires and billionaires. You said, no, we can't close any corporate loopholes for corporations, not for corporations that shelter profits overseas. We can't raise any revenue because that would be bad for Minnesota. And then tonight, we hear something different. We hear that this bill doesn't spend enough money. Our increase in funding for nursing homes and long-term care workers isn't enough. That 5% increase isn't enough. On behalf of nursing home workers, the disabled community, and our children, I think you should give us a little bit of a break. Democrats today will stand up for our seniors and our caregivers, and we'll pass a bill that will give them the first increase in 4 years. And let me repeat that, the first increase in 4 years. It's a fair plan. It's a part of a fairly balanced budget, and it will do far more for Minnesota and Minnesota seniors than Republican lip service. Our plan for Minnesota sets priorities, and one of those is increasing funding for nursing homes and for nursing home workers. Another is to ask the wealthiest Minnesotans to pay their fair share, to do the things that we think are important for the future Minnesota. This is a real plan, it's a responsible plan, and it's one that Minnesotans will support. I hope you'll vote yes. Thank you.
Representative Huntley.
Mr. Speaker and members, number one, there's a 5% increase for nursing homes in this bill. That's the first increase they've seen in 4 years. There is an increase for long-term care workers. It's the first one they've seen in 5 years. Some people on this floor can talk a good game, but when they're in charge, they don't do what they're telling us we should do today. There's lots of good things in this bill. Where is it? We have an MA rate increase for dentists, physicians, hospitals. We have repealed rebasing. The nursing home APS operating payments has not been used for years. We are putting more money into long-term care, which has not been done for years. We have eliminated TEFRA fees for low-income families that have a disabled child. What was done previously is you raise their reimbursement rates, their payment rates. We have reduced them. We have a fetal alcohol grant in Olmsted County, Representative Quam. We have changes in a special grant to the Zumbro Clinic in Olmsted County. It's not in the metro area. It's in Olmsted County. We have quality add-ons for high-needs children in poverty. We have child care assistance for disabled caretakers. We have repealed the family cap that you folks put on. We have parent support outreach, and one of the things I'm most proud of in this bill is what we've done for mental health for kids that have mental health issues. And the biggest thing that I think we've done is we put money so that we are willing to pay to have mental health providers stationed in a school. So when the kid needs to go to a mental health provider, he doesn't have to be taken out of school. He doesn't have to be taken to a hospital. He can walk right down the hall in his school and be treated by a mental health professional. That costs money, and we're willing to pay for it. We have funded food stamp shelves. We've expanded mental health care response by various providers. We have included training on how to deal with mental health issues. Members, there's a lot of good things in this bill. One of which we funded is maternal depression treatment. I can tell you that my wife had that when we had our first kid. She had no problems with the second kid, but it's a serious issue. And for the first time, we're doing something about it in this bill. We have done a lot to start to address the problem for sex trafficking of young girls. They're not ladies, they're girls. And they're being sex trafficked. It's a major issue in Minnesota, and this bill does something to help them out. I urge you to vote green.
Seeing no further discussion, the clerk will take the roll on the bill. Clerk will close the roll. There being 73 ayes and 61 nays, the bill is repassed as amended by conference and its title agreed to. Messages from the Senate.
Message from the Senate. This is the Hilstrom motion. Mr. Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendment concurrence of the House is respectfully requested. House File 80, an act relating to judgments. Hilstrom moves that the House concur in the Senate amendments to House File 80 and that the bill be repassed as amended by the Senate.
Representative Hilstrom.
Thank you, Mr. Speaker and members. House File 80 passed the Minnesota House 131-0. It went over to the Senate, and members, we've been working very hard with the industry to see if we couldn't get some agreement. In the Senate, they amended on a provision that says that if you're going to go after a consumer for debt that there's currently a 6-year statute of limitations. And right now what happens is some of the unscrupulous debt buyers have been purchasing some of the debt. They get someone to pay even $1, and then that revives the debt for the an additional 6-year statute of limitations. And so the agreement, we worked with the industry, the Attorney General's office, legal aid, and we've made some agreement that you must commence this consumer debt suit prior to the 6-year statute of limitations expiring, and you can't reignite it by getting someone to just pay you $1. The second provision that was added to the bill is we're getting rid of debtor's prison in this state. Currently, right now, if you're ordered to show cause or fill out a form showing how much you make and other information, right now, if you fail to do that, you are put in jail under contempt of court. Well, typically what's happening is they make the bail amount the entire amount that you owe for the debt. And then what happens is once the court receives that money, they then give the entire amount to the credit card company or whoever is suing you. And so what we're saying is that now the bail must be set at $50 for the first time you fail to comply. And then after there's a second contempt, then you can go ahead and raise that amount. But after that bail amount is collected, it gets returned to the person who paid the bail and not just given over to the creditor. And the only other provision that was really changed of any significance in the debt buyer piece that we had passed 131-0 was we actually added the language of what the notice is to the bill. Members, it passed the Senate 49-0, and I ask for members' support.
Any discussion on the motion to concur? Seeing none, all in favor say aye. All opposed, no. Motion prevails. The bill, clerk will give the bill its third reading.
Third reading, House File 80, as amended by the Senate.
Third reading. Any discussion on the bill? Seeing no discussion, the clerk will take the roll. The clerk will close the roll. There being 134 ayes and 0 nays, the bill is passed as amended by the Senate and its title agreed to. So everybody can just kind of talk among themselves for a moment. Okay. Motions and resolutions. Copies of the non-controversial motions and resolutions are at the front desk and online. If there's no objection, we'll take those motions first. Hearing no objection, those motions prevail. Announcements. Representative Murphy.
Thank you, Mr. Speaker. I move that when the House adjourns today, it adjourns until 9 a.m., Saturday, May 18th, 2013.
Representative Murphy moves that when the House adjourns today, it'll adjourn until 9 a.m., Saturday, May 18th, 2013. All in favor say aye. All opposed, no. Motion prevails. Representative Doubt.
Thank you, Mr. Speaker. And Representative Murphy, if she would yield for a question.
She will.
Thank you, Mr. Speaker. And Representative Murphy, if you can give us an idea of what bills we might be, I know we're waiting for some conference committee reports and waiting for those to close up. If you'd give us an idea if you think some of those are close and might be in front of us tomorrow for debate, we would appreciate that.
Representative Murphy.
Thank you, Mr. Speaker. Representative Dowd and members, we were hoping we were going to take up the pensions bill this evening, but they're debating it currently in the Senate, so I would expect that they will finish that up at some point tonight. We'll be able to take that up tomorrow morning. I understand the Environment and Ag Conference Committee is near closing, as well as the K-12 Education Bill. And in the morning, I think we'll see the Transportation Conference Committee close up its work, and I believe State Government Finance. So as they finish their work and they come to us, there'll be time for us. Can you see me now? There'll be time for us to, to review those and then take them up so that we can process the budget and get on our way.
Representative Doubt.
Thank you, Mr. Speaker. Thank you, Representative Murphy.
Representative Murphy. Oh, Representative Hortman.
Mr. Speaker, I wonder if Representative Murphy would yield to a question.
Representative Murphy will yield, yes.
Representative Murphy, did you say something about bringing donuts tomorrow morning?
Representative Murphy.
Mr. Speaker and Representative Hortman, yes, indeed I did. And I'm good with my word. So, yes, donuts in the morning.
Okay. All right. Representative Dowd.
Thank you, Mr. Speaker. Would Representative Murphy yield for a question?
She will yield. Representative Dowd.
Thank you, Mr. Speaker. Representative Murphy, are those bipartisan donuts?
Representative Murphy.
Mr. Speaker and members, of course, they're bipartisan. They'll be multi-flavored. But seriously, if we want to keep talking, we could wait for the Senate to finish the pensions bill and take that up yet tonight. Or, Mr. Speaker, I move that the House do now adjourn.
Representative Murphy moves that the House do not adjourn. All in favor say aye. All opposed, no. Motion prevails. The House stands adjourned until 9 a.m. Saturday, May 18th, 2013.